significantly for the number of the individual with diabetes. And you can see in the each region from the Southeast Asia, say Southeast Asia, you can check the data is from 2024 is 106.9 the number of people with diabetes in million, and in 2050 you can check it's increased 184.5%. And from this prevalence, the type 2 diabetes is the most common type of diabetes. So I think maybe right now, if you in the first level of your undergraduate, I will talk later about the type of diabetes. And you can notice that type 2 diabetes right now is the most common type of diabetes, accounting for over 90% for all diabetes worldwide. And in this slide, let's check it out about the top 10 countries or territories by number of adult 20 until 79 years with diabetes in 2024 and 2050. Indonesia always in the top 5, you know, from the 2024 until 2025. The IDF, the International Diabetes Federation, that predict Indonesia still large number of type 2 diabetes. So that's why I think because in the future there will be the healthcare professional, so you have to consider and take more awareness, take attention about the diabetes education and diabetes prevention, also diabetes management. And let's move to the data from the top 10 countries with the largest number of adults with undiagnosed diabetes. So right now you have to know, not most of the countries they reported the data with undiagnosed diabetes in last year 2024. Indonesia as well in the top 3 regarding to the proportion undiagnosed, around the 73.2% proportion undiagnosed, right? So it's around the 15 million number of people in Indonesia is undiagnosed diabetes. So that's why as healthcare professional we have to give more conducting diabetes education to increase the community awareness to check their blood glucose so they can know whether they have diabetes or not. So this is our job. And after we know the prevalence, we have to know the number of adults with diabetes living in urban and rural area in 2024 and 2050 as well. So you can check right now, people with diabetes mostly they live in the urban. So maybe a lot of previous recent study have talked about this issue, because I think right now why type 2 diabetes not only in adult but in young generation, because their lifestyle and also habit is really bad right now. So that's why this data is, although I do agree that most of the patient with individual with diabetes is living in urban instead of rural area. And also, so this wise, this prevalence and the information I have provided in the previous slide is about the double burden. So high prevalence of both type 2 diabetes and type 1 diabetes. And in emerging economies like Indonesia, the growing trend of urbanization and lifestyle changes are contributing to the increased diabetes cases. And let's move to the economic burden. So in Diabetes Atlas, the 11 diabetes Atlas also have provided data about the total diabetes related health expenditure for adult 20 until 79 years old as well, with diabetes from 2006 to 2050. So you can check it out, the data from 2006 until 2050, they predict really increase for the economic burden. And in 2050, the IDF estimate the total diabetes related health expenditure will reach almost is over 1,000 trillion USD by 2050. So it's a lot, the impact of diabetes into the economic around the world. And in this slide, I think because all of you is right now is students, undergraduate student for the healthcare professional, so you have to know the risk factor for the diabetes. So for the risk factor, I think we divided into modifiable factor and then modifiable factors. The first one, we have to know that modifiable factors is healthy diet, sedentary lifestyle, smoking, and excessive alcohol use. And for non-modified factors like age, genetic, and ethnicity. So we can, so this is a non-modified factor. So we have to know about those things. And the rising prevalence in new generation. So I mentioned before that the type 2 diabetes is no longer just an adult disease. Children and adolescents are increasingly diagnosed due to the poor lifestyle choices. So the most important is because the lifestyle is included in the modifier factor. So as a healthcare professional, we have to increase or improve the community awareness about this one, so we can reduce the number of diabetes cases in children or in young generations. Then why this today I have choose the topic about diabetes prevention, which is matters or is important, since we know that the burden of diabetes of its complications, the complication of diabetes, high blood sugar leads to the severe complication like heart disease, stroke, kidney failure, neuropathy, blindness, and amputations. This complication reduces the quality of life and can be fatal also as well. And diabetes-related complications significantly reduce life expectancy and increase healthcare costs. So most of the recent study have talking about quality of life in individual with diabetes. So I have read that some publication in high quality journal. I think most of individual have still have a lower the quality of life. So that's why diabetes prevention, also diabetes management is important. And more than 70% of people with diabetes experience at least one complication, making prevention a key goal. Maybe if you are a student in the maybe sixth semester and have you experience in doing clinical setting in the community or in the hospital, maybe you can check the patient with diabetes, at least they have one complication, right? So that's why the prevention and also the early diabetes prevention is crucial. Not only that, the previous uh, studies also talking about the prevention and treatment. And prevention of type 2 diabetes through lifestyle interventions such as diet and exercise can reduce incidence by as much as 58% in high-risk populations. And the role of early detection as well. The earlier diabetes is detected and managed, the better the outcome. And regular screening for the pre-diabetes and type 2 diabetes is critical in detecting high-risk individual. And improve quality of life as well, that I mentioned before. And also I have information that the government like global organizations such as WHO, IDF, or American Diabetes Federation as well, or we call ADA, are advocating for diabetes prevention for reducing the high-risk healthcare burden. Since we know that the impact of diabetes in economic burden is significantly impactful. And this opportunity, I think if you right now you can type in this link diabetes.org/diabetes underscore risk and test. You can check. This is my result. So I have low risk for type 2 diabetes. So this is for free. You can check in the Google and tap this link and you can start check whether you have high risk or low risk for type 2 diabetes. So this is the test by the ADA. As you remember, the name is type 2 risk test. And for the risk test, you will answer some question for the system or website in the link I'm in the previous slide. Like how old are you? Maybe the how are you? They gave me less than 40, 0 point and 1 point, 2 point, and 3 points. And are you man or woman? And the third one, if you are a woman, have you ever been diagnosed with gestational diabetes? And for do you have mother, father, sister, or brother with diabetes? This is according to the family history, right? And the fifth is, have you ever been diagnosed with high blood pressure as well? And are you physically active? And the last one is, what is your weight status? And for your weight status, you can check in the right side for this one. So you can right now, you can start to check whether you have high risk or even low risk for type 2 diabetes. I think it's early detection is important for us. And this is let's start to the definition of the diabetes, because right now it's from all multidisciplinary joining this lecture. So I have to remind of you that diabetes mellitus is a chronic condition that occurs when the body cannot properly regulate blood sugar glucose. This is due to either of lack of insulin production or insulin resistance. So you have to, as a healthcare professionals, healthcare students, you have to know about the definition of insulin, the lack of insulin production or insulin resistance. Since diabetes mellitus, due to the both one, like insulin production or insulin resistance, or even both. This is the type of diabetes. So you have to know, right? Recently we have a new one. This is called the diabetes type 5. So it's according to the malnutrition, chronic malnutrition related diabetes. You have to learn by yourself what is the diabetes type 5, since right now we have limited time. So you can check out in the Google or in the internet and type, or in the chat GPT, what is the diabetes type 5. Since diabetes type 5 has been published uh, in the April this year in Bangkok as well, in the International Diabetes Federation a conference, and I have joined that, and they have announced we have like new one is called diabetes type 5. So as I have to remind you, we have also as well, we have like diabetes type 1, diabetes type 2, gestational diabetes, and other type of diabetes. This one I have summary the differences between those type of diabetes. For example, like type 1 diabetes is autoimmune destruction. So that's why if you notice that most of the type 2, the individual with type 1 diabetes is children or is young. So this is because they got the autoimmune destruction, then they can distract the pancreas. So the pancreas cannot produce insulin at all. It's called the insulin deficiency. And for the type 2 diabetes, is chronic metabolic disorder characterized by insulin resistance and relative insulin deficiency. So it's easy to know the difference between type 1 diabetes. Type 1 diabetes is the pancreas organ cannot produce at all for the insulin, because this is full destruction. And type 2 diabetes, they can still produce little for the insulin, so it's called the insulin resistance. So for the type 2 diabetes, usually adult more than 40, increasingly in the adolescents and young adults with the obesity. And for the midwife students, who have to know gestational diabetes mellitus. For gestational diabetes mellitus is the glucose intolerance first recognizing during a pregnancy. So for the pregnant woman, usually 24 until 28 weeks gestation. So that's why, as you right now as my midwifery student, you have to know, you have to recommend in the future, if you have a patient with the family history who have the type 2 diabetes, you have to recommend them to check their blood glucose during their pregnancy. So to check whether they have the gestational diabetes or not. And other type of diabetes, for the other type of diabetes is include the rare from such because this is the monogenic diabetes like such as MODY, and secondary diabetes due to the pancreatitis, medication, or endocrinopathy. So for the other type diabetes is my I have read some previous study that for the other type of diabetes is best some virus or bacteria can also disrupt the pancreas organ. Also they cannot, they make the pancreas organ to do the insulin resistant or even the insulin deficiency. And the last one, as I call, this is the new one, type 5 diabetes. So diabetes associated with the undernutrition or malnutrition, so often in rural or underserved population. Because the International Diabetes Federation has conducted a long research in the Africa region. Because as you know that most of the Africa area is still an underserved population. So that's why most of them got the chronic malnutritions in the Africa, and then they will, for the long chronic malnutrition, they will impact to the pancreas. So they affect the by chronic under population. They affected by chronic undernutrition. Also, low socioeconomic setting, one of factor can influence someone who got a type 5 diabetes. For the risk factor, I think you can check it in detail by yourself. This one is the risk factor for each type of diabetes. And this is also quite important for high care students. And let's start with the diagnosis. As especially nurse and midwifery, you have to know the criteria for the diagnose the diabetes patient. For the diabetes, we have like when you check the blood glucose level, we have categorized into the fasting blood glucose, and we have like 2-hour plasma glucose and SPA. Maybe in the hospital in Indonesia, like 2 hours postprandial. If you have experience doing clinical setting in the hospital, right? Like 2 hours plus 2-hour postprandial is mean the 2-hour plasma glucose. So we have to check 2 hours after the patient or individual gotten foods or drinks. And SPA1C, this is also the accurate one. It's classified hemoglobin, but it's quite expensive compared to the other check. Also, the random plasma glucose. For the fasting plasma glucose is around this point more than or equal 7.0 millimole per liter. Also, I say it's common in Indonesia using milligram per deciliter is 126. And for the 2 hours plasma glucose and random plasma glucose is similar, is 200 milligram per deciliter. And for SPA1C is equivalent to 6.5%. And for impaired glucose tolerance or impaired fasting tolerance is called the pre-diabetes. So the pre-diabetes, so that's why when you have a patient or you have friends or you have family, after checking blood glucose, they got the pre-diabetes, you have to remind them to control their blood glucose and change the habits before they got the diabetes. Because if someone still got the pre-diabetes, you can still get back to the normal blood glucose level. So impaired glucose tolerance, you have to know this is the range to be the pre-diabetes. I think right now, as young generation as well, I would like to say you have to check at least once a month to check your blood glucose. I did myself as well to check because I have the father who got the type 2 diabetes as well. So that's why I have a 6 time the chance to get the type 2 diabetes. So I have to control my lifestyle and also I have to check my blood glucose regularly as well. So it's quite important. And for the symptom, I think this is also you can check it by yourself and read. This is I provided the symptom for each type of diabetes. And maybe I would like to explain type 2 diabetes, most common one. The for type 2 diabetes, if you the individual who commonly complain about the frequent urination or polyuria, polydipsy, and polyphagia is three poly is the common symptom in diabetes. And also sometimes they feel fatigue, also blur vision, and sometimes for the type 2 diabetes they already have some infection. If they did not notice, they have the a bad glucose number. And also for the gestational diabetes, if I think it's quite the same for all the time, is they have polyuria, polydipsy, and polyphagia. Also, they have fatigue as well, and sometimes weaken or difficulty losing a pregnancy weight. And as you know, because right now you are still this is my recent publication. Also, I I did survey with my team to check whether the undergraduate students have pre-diabetes or not. And surprisingly, you know, from the 327 undergraduate students aged 18 until 25 from three universities in Indonesia, you know, is 1.4% or around 70 participant is getting the pre-diabetes. See, it's quite a lot, I think. So that's why our recent study have reported that younger generation got the pre-diabetes or even type 2 diabetes already. So that's why it's quite awareness to us to have to check and to check your blood glucose level. And then if you got pre-diabetes, you have to change your habit and your lifestyle to prevent to get diabetes. And this is also because in this publication I have investigated the important variable psychosocial health is about the fatigue and sleep quality, and also the mental health including depression and anxiety. And from this information, I have to say to all of you that most of the pre-diabetes in undergraduate students, most of them feeling fatigue, and also they most of them if got the sleep disturbance, and most of them is feel depression or also anxiety. So that's why I have included in this publication that fatigue and sleep quality and also mental health as a hidden predictor to getting pre-diabetes in undergraduate students. So if you're right now feeling most of you feeling fatigue for this month and regular feeling fatigue, or you got the lack of sleep hours, and also the you feel anxiety, I have to say you have to check your blood sugar level. And next is about the role of different discipline in diabetes prevention. Let's start for each multidisciplinary. Let's start with nursing and midwifery as a front line of diabetes prevention. So in this, I have discussed a lot with the IDF member to know the role of nurse and midwifery as well. So most of the important role for nursing and midwifery is about the education and the patient advocacy. You know that nurse and midwife play critical role in educating patient about the risk of diabetes and the lifestyle changes necessary for their prevention. Especially midwife, you have to give more education if you got a patient about the gestation, the patient with the gestational diabetes or CGM. And also, they can teach self-management skills such as monitoring blood glucose, administering insulin, or managing diet and exercise. So that's why I still remember when I was undergraduate student as a nurse, you have to learn how to check the blood glucose level, and how to administer the insulin, right? So as a nursing student, you have to really understand for those things. And not only education and patient advocacy is about the screening and early detection as well. Nurses are often the first point of contact in healthcare setting and are crucial in identifying at-risk individuals through routine screening. For example, like blood pressure, weight, and blood glucose level. And regular monitoring of blood sugar level,
Well,
especially for individual with a family history. As I mentioned, if you someone who have family history of diabetes, they have the sixth time a chance to get diabetes
well,
in the future. And this is the role of midwifery in pregnancy and
well,
gestational diabetes. So, midwife and nurses involved in prenatal care can educate the pregnant woman about the risk of gestational diabetes and how it increased the likelihood of developing type
well,
2 diabetes later in life. I have to say to the midwife, if you get a patient with gestational diabetes, you have to control the 6 month for the blood glucose level, and not only and also after
well,
delivering the baby. So after delivering the baby, the mother can have a higher risk to get a type 2 diabetes after the pregnancy. So that's why you have to
well,
recommend to them to check regularly their blood glucose level after delivering the baby as well. So therefore, the midwife play a key
well,
in monitoring maternal health, offering lifestyle advice, and encouraging healthy eating and physical activity during the
well,
pregnancy. And this is the guideline. So I have to, if maybe if you have project in the future, maybe you will conduct some
well,
education in the primary health clinic such as a puskesmas or prolanis, because Indonesia we have a program like prolanis as well. You can take this guideline, right, that I mentioned in this slide. So the
well,
ADA, or the American Diabetes Association, and the and this one, the national standard DCMES. So right now you have, if you're interested in diabetes field, you have to really familiar with this concept. Is about the national standard for diabetes self management and education and support. Is called the DCMES. And the new one is the ATA have been renewed. I think in in 20, this is new one, 2022 National Standard for Diabetes Self Management, Education and Support. So right now, if you have a project according to the diabetes education, you have to check this guideline. I think this guideline is quite up is appropriate as a healthcare student or healthcare or even healthcare professional to provide uh, a good guideline in providing diabetes education in clinical setting or in the community. And I need to explain briefly what is DCMS because this is quite important to healthcare students. And DCMES, or Diabetes Staff Management Education and Support, is the ongoing process of validating the knowledge, skill, and abilities necessary for diabetes self-care, involving educational and supporting intervention to assist people with diabetes in managing their condition. So the main term of the CMES concept is the ongoing process in facilitating knowledge, not only knowledge, skill, and abilities for the individual with the diabetes. So this one, if you want to conduct the or want to do the health diabetes education, I think at least you have to check those concepts from the ADCES 7 self-care behavior. The first one, of course, you have to check the healthy eating and also being active or a physical activity, and how monitor the blood glucose and taking medication. So for the most important is for at least you have to provide for a point this one if you want to do the diabetes education to the patients. And if you have more top or more time to do the diabetes education to the patient, you have to as well to provide some problem solving, healthy coping as well, like stress management and reducing risk like food care or screening. So you have to check in detail in the for free in the Google and type the DCMES guideline that I mentioned in the previous slide. So this is an example for the publication, the role of nurse in diabetes management or diabetes education. So this is published in Journal of Telemedicine and Telecare in 2021. So this project, the title of this project is the effect of nurse-led web-based intervention on people with type 2 diabetes mellitus, a systematic review and meta-analysis. So systematic review and meta-analysis is they combine the result from the previous study. So that's why sometimes if you right now you have to know that if you're looking for the good quality evidence, so you have to, or it's called the evidence-based practice. I think I would like to recommend to all of you to check first one, the study with study design with systematic review or even meta-analysis to check.
Right.
And this result, I thought this result is nurse-led web-based intervention is promising way to complement our
Right.
medical care. So that's why the role of nurse in delivering diabetes education is a promising is important. And another
Right.
evidence about the is about nursing lead care versus usual care or cardio risk factor for patient with type 2 diabetes, systematic review and meta-analysis. And the
Right.
conclusion for this project is the nurse lead care is an effective and accessible intervention that could improve
Right.
HbA1c or improve blood glucose level, blood pressure,
Right.
PMI level among individuals with type 2 diabetes. So that's why right now you have to realize that if you are a nurse student, you have to know right in the future if you're
Right.
interested in diabetes field, you have to know um, the diabetes knowledge from the guidelines as well, because you know the nurse role is really
Right.
in is effective improving HbA1c level. After knowing the role of the
Right.
nurse and midwifery, let's move to the pharmacy and pharmacology. Since you know the diabetes is long chronic
Right.
disease, so they have to live with some medication as well. So as a pharmacist, you have to know the
Right.
role in supporting diabetes educations. In terms to according to the pharmacological intervention, for the
Right.
preventive medication, pharmacists can educate patients about medication like metformin, since as metformin is the most common one medication in Indonesia, as I know, that which is the sometimes prescribed to the individual with pre-diabetes to the delay the onset of type 2 diabetes. And how about their role in managing comorbidities? So many people with diabetes also suffer from hypertension, right? So I mentioned before, at least they have one complication for the patient with diabetes. So pharmacists help manage this condition, which can prevent further complication of diabetes. I think the main points in because I have discussed with a pharmacy as well in the my previous project. So I think most of the individual with type 2 diabetes for the first diagnose, they still lack of literacy for the medication. I think the I think the pharmacy is the top one profession to educate for its medication that have to use for the individual with diabetes. And for the counseling and lifestyle changes, so pharmacists are often direct contact with patient and can console them about the dietary supplements, so medication and lifestyle change. So not only medication, because since we dietary supplement such as vitamin or another supplement is quite important. So you have to really educate them which supplement or which vitamin can support their lifestyle to the individual with diabetes. And also pharmacists can collaborate with nurse and doctor as well to ensure medication adherence and track any side effects that might affect the patient lifestyle and diabetes. Maybe for your information that I have read some publication in the rural areas such as in Indonesia or another developing countries, the individual with type 2 diabetes still lack of medication adherence. So I think the pharmacist also can discuss with another professional. And the first, you have to know what factors influence their lack of medication adherence. And then after knowing the factors, you can discuss what is the best decision to improve the medication adherence for the individual with type 2 diabetes. Because right now, I think, as I remember, around 30% until 40%, they still lack of medication adherence to control and to go back to the clinics to take again for the medication. I think this is the pharmacist's role. And not only that, the pharmacist also role in the blood glucose monitoring. So pharmacists are key in helping patients understand how to use blood glucose monitors and interpreting results and educating them on how lifestyle factors can affect glucose level. And offering diabetes education
Wow.
programs and monitoring the effectiveness as a prescribed drugs and or device in diabetes management. So I have this one also an example. The journal have investigated the impact of pharmacist late intervention to improve clinical outcome for adult with type 2 diabetes at risk for developing cardiovascular disease, systematic
Wow.
and meta-analysis. And the conclusion as well that show that the pharmacy intervention provide evidence for the
Wow.
pharmacist decision's role in diabetes care management and reducing cardiovascular risk factors among adults with type 2 diabetes. So not only nurse and midwife, pharmacy also uh, the main one of the main profession can help and provide uh, diabetes care management in improving SPA1C in patient with type 2 diabetes. Let's move to the nutritionist or dietitian. So I think nutritionist and dietitian is really important to support in preventing diabetes in terms of diet or also nutrition. So healthy eating is a top one and the main important point if we want to do the diabetes education to the patient. So that's why the power of nutrition in diabetes prevention is matter. So uh, the other interventions discuss the critical of in preventing and management diabetes, involves healthy eating pattern, including the balanced diet of fruits, vegetable, whole grains, elite protein, and healthy fats. And also the weight management is important for the individual with type 2 diabetes. And also we have to know the macronutrient and micronutrient balance. So low glycemic index would still good choice for individual with type 2 diabetes. You have to, I think, as a nutritionist, you more understand how to conduct the the nutrition education to the individual with diabetes. Also, managing carbohydrates is really important. And right now,
Wow.
meal planning, as you know, but I have to say that for nutritionists, right now you have to understand that personalized meal planning is important. As you know that I have to say that each patient or each individual with diabetes is different, is unique. So sometimes you cannot do the similar pattern of the meal planning to all the patients. So you have to really understand the background of each patient can influence the dietary pattern for the each patient. So right now, most of the researcher conducting personalized or individualized diet plan for each patients. So that's why individualized diet plan is important for dietitian to provide some information according to the meal planning. And also you have to notice about cultural sensitivity. Sometimes you have to understanding the dietary preference of the patient and creating culturally sensitive meal plans that still promote diabetes prevention. So so I had experience when I did the clinical practice in Indonesia, right? Because some patients cannot eat this one, some patients cannot eat this one. So this is the nutritionist and dietitian role. You have to provide some uh, choices for the dietary pattern into the patients. And this also the evidence you can read as a nurse, and if you're interested in the effectiveness of dietitian involved lifestyle intervention in diabetes management among Arab population. So this study conducted in Saudi Arabia to evaluate the effectiveness of dietitian in involved lifestyle intervention in diabetes management. And the result also the intervention involving dietitian improve glycemic and metabolic outcome among our population. So that's why you can check in detail for free in the Google to read this evidence. I think this evidence for me is quite good because they provide some detail about the role of dietitian in providing a lifestyle intervention in diabetes management. This one also another publication using study design scoping review, exploring the role of dietitian in the identification or management of eating disorder or disorder eating in adolescent and adult with type 1 diabetes. For your information, some of patients with type 1 diabetes, they call the eating disorder or disorder eating for the individual with type 1 diabetes. So as a nutritionist, you have to know how can you provide the food, or you can provide the meal planning for this kind of the case. So that's why I have to say you have to read more papers to know another case of type 1 diabetes, since type 1 diabetes is most of them is still children or still young or even adolescents. So you have to really understand how you can provide some meal planning to them. And let's move to the medical record and data early detection and tracking progress. So for the medical records, I think it's quite important as well because, you know, sometimes the doctor or even nurse, they have to check the whole medical history of the patient to know how the patient did successfully to maintain HbA1c or even fasting blood glucose around. So they need to check the medical record. So for the health record, medical record specialists play a pivotal role in maintaining accurate and comprehensive patient data, which is crucial for diabetes screening and follow-up care. And by analyzing health record, they help identify trends in patient blood sugar level, risk factor, and progression through diabetes. So also in terms of predictive analytics, so medical record data can be used to identify individuals who may be at the high risk of developing diabetes, enabling early intervention. Sometimes the doctor, not sometimes, most of the clinician or nurses, they will check when the patient the control to the clinic or to the hospital. They have to check the medical record, and then the clinician can detect whether the patient in the future can got the complication or not. So that's why the predictive analytic from the medical record is really important. And also, the patient for the follow-up. The insurance patient data in regularly updated and accessible help healthcare professionals track long-term prevention strategies and adjust care plan accordingly. And as a medical record has also had collaborated with the all help another health professions such as nurse, pharmacist, and dietitian as well, to ensure that patient information is shared and accessible for the creation of holistic care plan for diabetes prevention. So that's why as a medical record, they have to really update the new medical history for the patient. So they can provide some information to the healthcare professional like nurse and or clinician or even the pharmacist or dietitian to check whether the meal planning is correct or not in improving HbA1c level, right? Because HbA1c is always have reported in the medical record for the patients. And this is evident as well. You can check and read in detail about the efficacy of personalized diabetes self-care using the electronic medical record, integrating mobile app in patient with type 2 diabetes 6-month randomized control trial. So for this project, the researcher have using provided mobile app based on their medical record for the patient. So that's why also, as I mentioned before, each patient is unique, so they did personalize as well for this project. So I think it's quite important. It's quite interesting, this project. So I have to say you have to check by yourself, because this app also significant improving glycemic control in the patient. So that's why you have to learn by this project how they can use the electronic medical record as a guideline in guide their personalized intervention. And the last one, I think, let's move to the dental nurses in diabetes preventions. So diabetes and oral health education. So I had experienced some of the individual with diabetes have a oral health complication. So diabetic patients are high risk for oral health problems like gum disease or periodontal disease, dry mouth, serostomia, or oral infection. So poor blood glucose control leads to weak immune system, which make it more difficult to fight infection in the mouth. And gum deletion can also lead to worsening blood sugar control, creating various cycle, and it has been shown that periodontal disease may worsen insulin resistance as well. And as a dental nurse, you have to screen as a mandatory right for oral manifestation for individual with diabetes, because this is the first noticed sign of undiagnosed diabetes during routine oral examination. So the symptom like chronic dry mouth, gum inflammation, or even unexplained mouth infection might signal need to further investigation. So they can educate patients about the link between oral health and diabetes and refer them for diabetes screening if needed. If you check in the internet, you can type like the relationship between oral health and diabetes. A lot of study have reported this evidence, because most of the patients who have a worse or bad blood glucose control, most of them is got also the oral health complication. So that's why the link between the oral health and diabetes is significant. And for the preventive oral care for diabetic patients, so the oral hygiene education also this is crucial. You have to educate patient about the importance of good oral hygiene as well. And for the patient-centered care, providing tailored advice to diabetic patients based on their oral health status, such as offering recommendation on specialist toothpaste or mouth to combat dry mouth or gum inflammations. And it's the same with another profession. You have to collaborate still with other healthcare provider. So you have to report in the medical record that about the oral health status. So the doctor, also the nurse, can see also in terms of whether they have the complication in terms of the oral mouth or not. And let's move to the innovation and future direction in diabetes prevention. So this one, if you check in the left side, this is it's called the continuous glucose monitoring, or CGM. So as healthcare professional in this era, you have to know this one. This one, I think, in the outside of Indonesia, especially in USA or even in Europe, this is common one already for the patient in the individual with diabetes using this CGM, especially for the type 1 diabetes, because for type 1 diabetes, as you have to remember, this type 1 diabetes is they got insulin deficiency. They have to check, they have to inject insulin regularly, and that's why they have to check as well their blood glucose regularly for an hours. And so that's why for the CGM can track blood glucose level throughout the day. This real-time data can help patient and healthcare provider adjust behavior. So for this CGM, they will connect to this their own smartphone. So that's why if they got a high blood sugar or even a low blood sugar level, they can do prevent or manage as soon as possible for the patient. So that's why it's quite important for this one.
Pardon
And
me, Dr. Debbie.
okay,
I just want to remind you that you still have 10 minutes later.
okay, 10
Yes,
minutes. Okay, I will.
10 minutes left. Yeah.
Okay. Thank you so
Thank
much
you.
for reminding. So I will follow and present the important point. And right now also we have like mobile health application. I think I realized that in Indonesia a lot of mobile application. However, we have to check which one mobile health application is accurate. Is accurate and is important and is accessible as well for you to support in diabetes educations. And right now, I think you can tap as well using artificial intelligence such as ChatGPT or the big data as well. I think it's okay. You can, if you want to get some new information in supporting your diabetes material for the diabetes education, you can type ChatGPT. However, you have to take carefully. Sometimes ChatGPT, because ChatGPT get some errors, so you have to check with the updated paper or updated journal in supporting for your materials. And this one is my project. So using digital assisted intervention in diabetes. So I have in this project, I have investigated many digitally assisted intervention and to investigate which one digitally assisted intervention is significantly most effective in improving glycated hemoglobin is called the SpA1C level. So you can check by yourself because you can get this publication in the Google. So this is the type of mobile interface type mobile application, and also we have like short message service and telephone call and another. And so in total we have like 17. Not only single intervention, they have also multiple intervention as well. Not only digital, also complementary intervention as well. So this one, the type of the intervention. So this is the explanation about the abbreviation for each interventions. And as you know that based on the component, the PSE peer support education is top one in improving around reducing around 1.50 SpA1C level. However, as you realize that PS peer support education is not digitally one. So which one digitally have improving significantly? This is the asset message service and mobile application and telephone call. So I think the score is quite similar, can reduce around 0.30 something in reducing SpA1C level. So right now in the future, if you want to, I think because I have noticed that some undergraduate students will have some project in the community empowerment, and you go to the community, you have to consider which one. Maybe you can use the SOAP as a service as telemedicine in supporting as a reminder to the patient. Also, you can use mobile application if maybe if you do the diabetes education in the urban area. Also, you can use telephone call as well. And also, me and my team also right now I have developed a platform in Instagram is called Diabetes Evidence. Is I think you can follow if you want interest in diabetes education. However, I have provided in English. So this because from this platform I've discussed and I've provided into the international diabetes prevention. So from this project, I have provided some updated journal or guideline in supporting diabetes patients. So from this project, I really hope can improve the literacy and awareness to the community, especially Gen Z, because you know the Gen Z right now is using platforms such as Instagram, such as Instagram. So I always remind them about the diabetes evidence so they can realize that diabetes prevention is really matters. And this is the community-based prevention program. I think you can do as well the local health campaign at school and work. You can do cooperation with the school and workplace as well in increasing awareness about diabetes preventions. So for the future of diabetes prevention, I think I already mentioned in the previous slide that personalized medicine, you have to consider using personalized since each patient is unique and different. So as a healthcare professional, you have to really understand the background of the patient and knowing what kind of factors that influence the diabetes management for each patient. And so that's why this project have been conducted as well using personalized diabetes text and combined with peer support educations. Also, this is an example. If you still remember the content of a DCS, we have like 7, but in this project I have used the 4 important point in terms of healthy eating: being active, taking medication, and monitoring blood glucose. This is an example, a message or reminder using personalized. So I mentioned their name, and I mentioned their exercise or healthy eating based on their preference as well. And this is also for the future, you have to consider the behavioral science and also social determinant of health. And why I have to mention social determinant of health, since right now, in diabetes, a lot of psychosocial issue like stigma or something from this communities. So that's why stigma right now is important issue influenced in diabetes management as well. This practical tip, I think for the practical tip, I think is easy to understand, and you can also get information easy from the internet for the balanced diet and smart carbohydrate choice. For the meal timing and regularity, I have mentioned before. And physical activity, I think also at least 2 or 3 times a week, and in total if 150 minutes a week as a moderate intensity activity. And for the activity level, most I think most of the recent study from the high quality journal have to recommend not only uh, encouraging not only using the moderate intensity, and also for the everyday movement, encourage taking stairs, walking during breaks, and stretching exercise. And this is stress management and sleep. Also the important point, as you know, the uh, sleep quality and also mental health has hidden predictor for pre-diabetes, right? So sleep and stress management also is important point. And this one as well, avoiding harmful habits such as smoking and alcohol. So regular checkup and monitoring is important point. So that's why right recently, if you have parents of you have family who have type 2 diabetes, you have to remember that we will get a 6 time chance to catch up to diabetes. If you don't have the family as well, you have to still check, because right now, young generation uh can high risk chance to get the type 2 diabetes. So you have to check regularly for your blood glucose level. And thank you very much. This all my presentation. I'm sorry if I got the overtime. So I will give time to the moderator, Miss Dr. Diana. Please, it's time for yours. Thank you. Thank you very much for your attentions, everyone.
Thank you very much for Dr. Devi Ramadan. Wow. Yeah, thank you for your insightful presentation on the future on diabetes prevention. Your emphasis on a multidisciplinary approach and the critical role of lifestyle changes, technology, and community engagement has provided us with the valuable perspective. And you also have give the talks for on time for 1 hour. Thank you.
Yeah.
And as we delve deeper into the important topic, I invite the audience to engage in a discussion. So please feel free to share your questions or insights. Also, you can open the microphone and let's explore how we can collectively address the challenges of diabetes prevention. And from our chat room, we already find wow, several questions for you, Dr. Debbie. Mr. Dr. Debbie, yeah, we call it Dr. Debbie because he is still young. Okay, this is the first question from Nur Aji. Nur Aji is one of our lecturer in Health Polytechnic from the pharmacy department. His question, yeah, thank you for the presentation. He said that the material was very interesting and he gained many new insights. And he has one question that he would like to ask. The question, how can undernutrition trigger the development of type 5 diabetes, and has type 5 diabetes been officially recognized in the nomenclature of diabetes classification? Okay, Mr. Debbie, time is yours.
Okay, thank you very much. This is really good questions from the Mr. Nur Aji, right? As a lecturer from the Health Polytechnic of Tasikmalaya. Okay, according to the new type of diabetes. So first time I know this type from the IDF a conference in early April this year. So I feel surprised as well at the time. So because the IDF finally officially recognized the new one is type 5 diabetes as a new type of diabetes. It's called the type 5 because in the previous we have known that only 4 and right now type 5 diabetes. Why finally IDF mentioned and have to officially recognized as a new one? Because IDF team have been conducted this research in more 60 years old in in Africa region. So they did research how can the chronic malnutrition can destruct the pancreas. So that's why it's different from type 1 diabetes, because type 1 diabetes they got the disease or some virus and or some genetic can destruct the pancreas organ. But for type 5 diabetes, it's really from the chronic malnutrition. So undernutrition for the chronic more than 5 years, they mentioned, I still remember more than 10 years or more than 50 years, someone who stay and live in rural underserved populations such as in Africa, they will impact to the not only pancreas but all organ in their body. Particularly if we're talking about diabetes, of course, they will impact to the pancreas, and you know the beta cell of the pancreas have to get enough nutrition to get the function of the cell beta pancreas as a production insulin. So that's why the chronic undernutrition in underserved can impact to the can disrupt to the pancreas organ, and also the influence the function of cell beta, and then they can classify as type 5 diabetes. However, they also mentioned the IDF team are still conduct more research in the future to to know comprehensively about this issue. I with my team as well, right? Also with Miss Diana, I also have some project in evaluating the type 5 diabetes in the community as well. Right now we have like 3 projects still under review about type 5 diabetes. Thank you so much, uh, Mr. Nur Aji, for the questions.
Thank you, Mr. Dr. Debbie, for the insightful response. Yeah, talking about the nomenclature of diabetes classification related to maybe especially for my department from medical records. Yeah, this is the nomenclature in ICD codes. How about your opinion about this, Dr. Debbie? Is it already included in the ICD? Or the type 5 diabetes?
What you mean? What do you mean? Can you? I cannot hear your voice clearly. Can you repeat?
Yeah, ICD. Because from the Department of Medical Record, the students learn
Oh, okay, okay.
yeah, are learning about the ICD. For now is ICD 10 they
Hmm.
learn. So is it the code of type 5 diabetes is already included in the ICD codes?
I think it's not yet, because this type testing published already new is in early April, and this is data is from the IDF as well. So that's why if you type 5 diabetes in the internet of in the Google, it's still lack of evidence in reporting type 5 diabetes. It's only from the website and only from the official website for IDF. However, I have read some clinician around the world, such as in the US and Europe, also have more attention for this type and conducting more research. But for the what you call ICD, I think it's
Yeah.
not yet in, because I think still have process maybe next year or next 2 year to officially include it in type of database. But the most important point is not like that, and the most important, this is new knowledge and new literacy as well. How important we have to provide enough nutrition to the community in preventing in preventing such as new type of diabetes as well. Mm,
Okay, Dr. Debbie. Yeah, yeah, ICD. ICD is International Classification
mm.
of Diseases from WHO. Okay, thank you, Dr. Debbie. Now we are going to the next question. This is from Dewi Hernawati from Midwifery Department. She said that thank you for your insightful presentation, and she also interested in this to discuss about type 5 diabetes or malnutrition related diabetes mellitus (MRDM), which is particularly concerning for adolescents in developing countries like Indonesia. The questions are: how is type 5 diabetes diagnosed? And the second, some studies mention that is adolescent girls blood glucose levels are influenced by hormonal fluctuations during the menstrual cycle. What is your opinion on this relationship? Okay, Dr. Debbie, time is yours.
Okay, thank you very much. This also is a good question from the midwifery students. So I have mentioned before, type for the diagnosis, of course, is the same. Uh, I mentioned before the type of diabetes, all type of the diabetes diagnosed by the checking blood glucose level in terms of fasting blood glucose level or SpA1C level. However, I recommend you to check all type of diabetes using SpA1C level, because SpA1C levels can give you image for the 3 months, 3 month of the record of blood glucose level. So that's why when you check not only type of diabetes, type 1 or type 2, first time it's okay, you can use the fasting blood glucose level. But however, I have to recommend you to check to the hospital or clinics about the SpA1C level to get the accurate result. And the another important point is some studies mention that in adolescent girl, blood glucose level are influenced by hormonal fluctuation during the menstrual cycle. What's your point? Okay, this is, I think, not only evidence talking about this one. However, I have read this issue for the adolescent girl. So the general knowledge you have to know as midwifery, that hormonal fluctuation for the adolescents, not only adolescent, hormonal fluctuation in adult as well, can influence how all hormone in our body, not only hormone but also the function of the beta cell in the pancreas. So that's why you have to really understand what the function of insulins. Insulin is the can we have like hormone insulin and glucagon as well as opposite hormone. So this when some adolescent girl or even adult get the hormonal fluctuation in their body, of course they can impact to the blood glucose level. So especially someone who got the bad lifestyle habits is more got worse for the has chance to get the high glucose level for the adolescent levels. So for this issue is a, for this relationship is according to the, you know, I have to say the hormonal fluctuation can influence the another hormone in our body, especially the function of the insulin and also the glucagon. Thank you.
Okay, thank you, Dr. Debbie. I think you already explained very clearly. And maybe there is one of the participants, if you want to open your microphone, you can raise your hand.
Yes, I think I want to hear your voice as well.
Or maybe one of the lecturer. Okay, maybe we continue to the next question. Yeah, from Ella Nur. Era Nurlaili from the profession of midwifery. His question, she said that yesterday there was a baby delivery with a precipitate labor resulting in a spontaneous birth of a baby weighing 2.2 kg. The baby was born spontaneously but didn't cry immediately. After receiving oxygen, the baby began to cry, but upon examination, there were abnormalities in the baby's eyes resembling cataracts or glaucoma. After the oxygen was removed, the baby's oxygen saturation decreased every 2 hours, and the baby did not want to breastfeed due to weak sucking. The baby was referred to the hospital, where it was found that the baby glucose level was nearly 300. However, the following day, the mother's blood sugar was checked, and the result was only 110. The question, how is it possible for the mother to have normal postpartum blood sugar while the baby's blood sugar is high?
Mm.
Okay.
Yeah, thank you very much. Oh, this really hard question, I think, because this is a case study as well. But I think this is really important point I have to say to all midwifery students. So this is an example. How can the baby can have the high blood glucose level, right? But the first one, you have the first one, you have to know the history from the first month until 6 months of the mother. Sometimes if you check the following day in the final, the even the mother have 110, is this a range of pre-diabetes or even normal? However, you have to check SPA1C level, because during the SPA1C level you will know the history in each in 3 months past, what the average the SPA1C level. This is the first thing that you have to check for the mother. So because when the baby got the high glucose level around 300, and I'm not sure this is the fasting blood glucose or random blood glucose. I have to confirm to you as well. But the main point is when the baby got a high blood glucose level, as I know, or as my experience from my and from my literacy as well. This is from the nutrition from the mother, the first important point. But another one is not only nutrition, but another factors such as the stress. Also, stress management also can influence the blood glucose level for the baby as well. So that's why I think this is quite interesting case. However, you have to check the history, family, the SPA1C level for the mother. And I guess I think the history for the mother also can get the high SPA1C as well. So that's why the baby can get the high blood glucose level. Thank you.
Okay, thank you, Dr. Debbie. We still have several questions. Another question is from Desi and Zalifa from the pharmacy program. Okay, she said that before that, I would like to express my sincere gratitude for the enlightening presentations. Yeah. Okay, the question is the first, how can we differentiate malnutrition related diabetes from type 1 or type 2 diabetes in patients with a history or poor nutrition? And the second question, do patients with malnutrition related diabetes have different microvascular complication risk compared to those with classic diabetes? Okay, Dr. Debbie,
Okay, let
I'm
me read.
yours.
Okay.
Yes, you can read it.
Okay, this is a good question as well. So the first one you asked to me about how can we differentiate malnutrition-related diabetes from type 1 or type 2 diabetes in patients with history of poor nutrition. Actually, for the malnutrition-related diabetes is included into the type 5 diabetes, right? For the type 1 and type 2 diabetes, you have to know the differences. Is type 1 diabetes is insulin deficiency. So it's called the genetic, or you get the genetic to the individual who got type 1 diabetes can disrupt the pancreas, and the function of cell beta cannot um, process insulin at all, so it's called the insulin deficiency. For type 2 diabetes, of course, it's about the lifestyle, so and also the lack of physical activity, and another thing, factors, a lot of factors for the type 2 diabetes. So type 2 diabetes, of course, is not is they of course they get, most of them get bad healthy eating, so they consume more carbohydrates, lack of protein and everything. And then so that's why, the carbohydrates can increase a blood glucose level easily. So that's why if you get intake carbohydrate more than your calorie intake daily, of course you will get the type 2 diabetes chance. But type 2 diabetes also got from the family history as well. Like I mentioned before, my father got type 2 diabetes. Of course, I got the sixth time of type 2 diabetes. So according to the malnutrition, so I think for type 1 diabetes, not on based on malnutrition. Type 1 diabetes is from the genetic and from the uh, some factor which disrupt the pancreas to get the insulin deficiency. For the type 2 diabetes, yes, breast and nutrition and healthy eating can influence insulin resistancy. So for type 2 diabetes, it's called the insulin resistancy. And the second one is, do patients with malnutrition related diabetes have different microvascular complication risk compared to classic diabetes? I do not understand what your second question actually.
Okay, maybe. uh, oh, I see. Desi, maybe Desi, can you open your microphone to re-explain or get related to your question?
Hmm.
Yeah. Or maybe you can type again in Indonesia. I will translate it. Okay, thank you. In Bahasa. Okay, maybe we
Because
move
what
to
is classic diabetes? Because you
maybe
mentioned classic diabetes. Maybe, or you
talking about
think,
type 1 or type 2 maybe, Dr. Debbie.
okay. So
Yeah.
I think for the complication, I think it's quite the same for the complication. If you're talking about type of diabetes, type 4 diabetes is based on their originality cause from. So if you're talking about the complication, even the microvascular or macrovascular complication, so all type of diabetes, even gestational diabetes or other type of diabetes, still have chance to get the microvascular complication or microvascular complication. It's the same. It's if you do comparison, I think it's similar. Have chance to get the microvascular or macrovascular complication. Okay, maybe that's my answer to your second questions.
Yeah, I think she already got a point.
Hmm.
And then
Thank
maybe
you so much.
we are back to previous question. Yeah. To Ella Nurlaila question that when she talk about the delivery, baby delivery, there is one clarification from Dewi Arianti. She is a lecturer from Health Polytechnic. She asked, is it possible that her mother blood glucose levels decreased because the placenta was no longer producing insulinized hormone? You can check the question, the very lowest from Dewi Arianti in the chat room.
Dewi
Yeah, Dewi Arianti. Yeah.
I did not find.
Okay. I will read again. Is it possible that her mother blood glucose level decreased because the placenta was no longer producing insulinase hormone?
Okay, this is according to the according to the previous question, right? The case study, right?
Yes, yes, the case study, that
Yes.
one.
Oh, okay, I remember. Um, but this kind of maybe this thing is one of factor. However, my personal thing is not main factor. So uh because I'm not a midwifery expert, right? So I think, but for my perceptions, so this for the delivering after the placenta is delivering the placenta for the baby, I think it's okay, it can reduce, but I think it's not really significant factor to influence the blood glucose for the mother. So you have to check because you have to check the history as well. I mentioned before, you have to check SPA1C level, and you have to collect the comprehensive information related to the healthy eating or another factor from the mother, from the mother, maybe in terms of healthy pattern eating or something 3 months before they delivering the baby.
Okay, thank you, Dr.
Mm,
Devi. We still
mm,
have two last questions.
mm.
Uh, the first is from Leslie. She asked about diabetes. What can we do to support the pregnant mother and postpartum mother who has diabetes? That's a question.
Okay, this I think I mentioned before in the my slide, right? So if you got first time, if you got the patient the the pregnancy woman who got the gestational diabetes, of course you have to educate some important point, such as the fourth point from the ADCE as a self-care behavior. I think not only gestational diabetes. If you first time you got the patient or individual who got the diabetes, you have to educate them what is the diabetes to the patient and how to control how to control the blood glucose level is matter for the gestational diabetes, because you have to save your baby as well, and you have to control your blood glucose level. And you have and after postpartum is really important, because after postpartum the baby and also the mother have high chance to get the type 2 diabetes. So you have to check, like in the case study, you have to check both between both mother and the baby regularly, to check the monitor, for monitoring the blood glucose level. Maybe at least 2 years they have to check really regularly, to check whether the blood glucose pattern not increase, still have in normal range or pre-diabetes, or into to type 2 diabetes. So that's why this is, I think, the most point. And in addition to the regular check monitoring, of course you have to give some information in terms of healthy eating, physical activity, and stress management as well. Thank you so much.
Okay, thank you, Dr. Dabi. And this is the last question because the time is already 12 o'clock now.
Yeah, yeah,
Uh,
yeah.
yeah. From Nurfitria Sari, from the midwifery program, she asked how to maintain the motivation of diabetes patients to adhere to a healthy lifestyle, as I often encounter patients who appear stressed because they feel uncomfortable with the restricted foods. Sometimes there are those who comply, but their blood sugar remains high due to stress. In your opinion, is there a possibility for patients to recover, or do they have to live alongside their condition while changing their lifestyle to manage their illness? Thank you.
this, this also case study, right?
Yeah. Yeah, yeah.
Yes, it's quite important. Basically, is, I have experience in educating some different background of the patients in Indonesia. So the main point is you have to know the background really in detail for the background for each patient. But for this case, I think you still can do educating by including their family as well or their relative to support their decision in terms of their habitually as well. But I think it's quite difficult. However, approaching to the family, I think is the best decision to help to solve their problem as well, I think. And also you have to remind using technology as well. I think it's kind of support them. And you can discuss as well to recommend them to consult with psychologists. I think right now health psychology is important in supporting the individual with diabetes who got some psychosocial issue. So this kind of thing that I have to recommend to, if you can got this case of study. Thank you so much.
Okay, thank you so much, Dr. Debbie. And because I think the time is already reaching 12 o'clock, so I will give a short conclusion from our uh, presentation from Mr. Debbie today. That maintaining motivation in diabetes patients is crucial for their adherence to healthy lifestyle, especially when faced with dietary restriction and stress. While full recovery may not always be possible, effective lifestyle changes can help patients manage their condition and improve their quality of life. And thank you very much to Dr. Debbie for your very insightful presentation. Okay, before we end this session, so we would like to give you a certificate. Okay, maybe the certificate can pop out to the monitor, to the screen. Or okay, maybe the certificate is not ready yet, so I
Okay,
end
it's
this.
okay.
Yeah, yeah, I end this session. Maybe will be given. Oh, okay, already. This is your certificate, Dr. Debbie. Yeah, thank you very much.
Okay, thank you
Yeah.
very much.
Okay, so I end this session. Thank you so much also to your very insightful talks, and also to all the participants today. Reach one K participants, and then I give this to I this the microphone to back to Master of Ceremony. Okay, time is yours. Thank you.
Okay, thank you very much for all attendance. Thank you very much.
Okay, thank you very much to our moderator. Okay, so ladies and gentlemen, before we close today's session, we kindly ask all participants to complete the attendance form, and for the attendance form will be open until 2 p.m. And the link has been shared in the chat box, so please make sure to fill it out. In addition, there will be a post test that you are required to complete, and the post test will be open 30 minutes from now. So please make sure to finish both the attendance and the post test. Okay, ladies and gentlemen, we have now come to the end of today's Stadium General. We sincerely thank you to our Honorable Director, distinguished speaker, and all participants who have joined us. We hope today's event brings valuable knowledge and inspiration for all of us. I apologize for any shortcoming while hosting today's session. Thank you very much for your kind attention. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi
Thank you for
wabarakatuh.
Ajija.
Wabarakatuh.
Link
Thank you
absensinya
for
tinggal
Ajija.
Yes, Miss.
Dr. Debbie, thank you very much.
Thank you very much. Nice to see you again.
Thank you for Miss Diana to facilitate the activity.
Thank you also, Miss.
Kakak MC izin,
Ya, silakan.
link absensinya tidak bisa diisi, Kak.
Oh,
Sudah bisa lanjut,
Sudah
coba.
bisa.
Sudah bisa, udah bisa.
Baik, Bu, terima kasih.
Saya izin live ya, Bapak Ibu dan semua peserta. Terima
Iya,
kasih.
Ibu.
Ya,
Mangga,
terima
Ibu.
kasih.
Terima kasih, Bu.